Good morning all. Today I will discuss something about the macula, the yellow spot. You see in this picture of retina there is the optic nerve, the peripheral blood vessels, and this central part is called as the macula. This part is responsible for the sharp images, color vision and the fine details. That means a crisp image of what we see. The macula or the central spot is affected in many diseases like diabetes, hypertension, central serous retinopathy, age-related macular degeneration, macular holes and some congenital dystrophies. Let me tell you in brief as to what will be your symptoms in various diseases. Diabetes is nowadays becoming the leading cause of blindness. Long duration, uncontrolled diabetes leads to macular edema, that is, a blister of fluid in the layers of macula. Patient will have blurring of vision or the diminished vision. If it is a long duration, then it can cause an irreversible damage and a permanent vision loss. Uncontrolled hypertension can also cause hypertensive retinopathy and the vascular occlusions, both causing the cystoid macular edema and the losing of the sight. Let's also touch the disease of the foveas affecting the young, which is directly related to the lifestyle. Type A personalities leads to the central serous retinopathy, which will be manifested as the central scotoma. That is a black spot in the center. Wherever you are looking, the black spot will remain in the center. The other important cause of vision loss is the age-related macular degeneration, causing the distortion of the vision. How do we diagnose all of these? We use the tools as fundus fluorescein angiography, in which we use a dye, and the optical coherence tomography, that is the OCT, which will tell about the vascular status and the ischemia and the amount of edema respectively. Latest tool is without using a dye, that is the OCTA. In most of these diseases, the effective treatment strategies is in the form of an intravitreal injection with or without the lasers. These intravitreal injections can be the anti-VEGFs like the ranibizumab, bevacizumab, aflibercept, to name a few, and a depot of steroid dexamethasone marketed as Ozurdex. These can be supplemented with the green lasers as a focal or a grid laser. They can be done independently or with the injection. Each treatment option has a considerable track record of success and works by decreasing the fluid. This was all about the macula, the disease, the treatment. Let us talk about how can we keep our macula healthy. Just a few changes in our lifestyle and nutrition can affect our status of our macula. We need to have a good control of diabetes and blood pressure. Change in our lifestyle just to reduce our stress, that is, add up a few exercises as your daily routine, some time for yoga, that can cause all the difference. We should take healthy nutrients, good amount of the specific vitamins like A, C, E, which are the antioxidants, the omega-3 fatty acids, which can be taken as the fatty fishes for the non-vegetarians, and nuts and the flax seeds for the vegetarians. Trace minerals like zinc and copper, which increases the absorption of vitamin A in the form of legumes, deep green veggies and the nuts. So you see, very small changes can keep our macula healthy and prevent the loss of vision in their later life. That's all for today. Stay fit, stay healthy and stay safe.